I'm here with Dr. Chaz from the local dentist in Bellingham. He's a veteran, a husband, father of four, business owner, and a practicing dentist with a unique vision for the future of his industry. Dr. Chaz, thank you for sitting down and talking with me today.
Yeah, thank you, Braden. Yeah, I'm originally from Louisville, Kentucky. That's where I was born and raised. Went to college at Western Kentucky University, University of Kentucky for graduate school. Then I commissioned as a naval officer and kind of moved around and just was always kind of infatuated with the West Coast, and eventually got stationed at Whidbey Island and then made my way up to Bellingham. And my wife and four kids and I, we just love it. It's great.
It's a common story, people moving up here and falling in love with it. So what made you want to go into dentistry?
Yeah, great question. I know most people come and see me and they don't like dentists. So people always ask me that. So my dad was actually a dentist for 25 years in my hometown. I think, seeing the impact he had on patients, in the community was cool. I always wanted to have some sort of skill, work with my hands, have something tangible to offer people. So kind of followed in his footsteps and kind of found my own way, and it's been a great career.
Very cool. And so I've been to your office, and it's different than a lot of other dentist offices that I've been to. So what was the thought process behind that? How do you try to make your practice different from other offices, and in what ways is it different?
Yeah, well, first of all, thanks for saying that, Braden. It took a lot of work to kind of cast that vision and create it, so I'm glad you noticed it. So I started my office. It's called the Local Dentist. It's in the Berkeley Village area about a year and a half ago. So I started from scratch. I didn't have any patients, existing clients, things like that. So we built it out. And the main reason I did that was because I wanted from day one to have our culture set, and a lot of dentists kind of inherit an older office and they kind of take it over and take what that is and then form it into their own thing. But from day one, we've kind of highlighted two main points of our culture. Number one, our approach to oral health. So, I think more and more knowledge is coming out of how your oral health or your mouth affects the rest of your body. They've now linked 57 different diseases to the pathogens that start in your mouth. And so kind of seeing the mouth as the gateway to the body and having a more systemic or holistic approach was really important to me. And then, the name of our office is a local dentist. So the second part of our culture we like to highlight is that we're here for the community. We're here for the city of Bellingham. And, in our guest lounge, we highlight other local businesses. I want people to think of our office if someone's in need or we need to be serving our community somehow, they think of us. And a big way that's been able to manifest is we have an in-house membership program that makes dental care, really quality, relationship-driven dental care accessible to both businesses and individuals both.
Cool, yeah, and I know that as a business owner myself, it was interesting to me to find a dentist where I didn't need a traditional dental insurance plan, which kind of took some education on my part because I didn't even know that was an option. I always thought if you need to go to the dentist, you either needed insurance or you were going to basically give up your life savings for a filling or something like that.
Right.
Tell us a little bit about how that works for someone that's not familiar with the industry.
Yeah, well, dental insurance companies, have been around a long time. I mean, they're a for-profit company. I don't blame them for that. But, typically they're going to get businesses or individuals to sign up and they're going to charge them a monthly premium and they're going to cover part or complete, services at a price that they set. But typically business owners don't realize that, these insurance companies know the utilization rate of that, right? So if it's something like the restaurant industry or music industry or healthcare, they know about how many people are going to use it, and they're going to keep drawing the premiums whether they use it or not. And so, for me, I wanted to offer something both to businesses where they could still be good employers and offer a membership program that their employees could get quality care, and quick and, relationship driven at an affordable price. And so I think that's what people don't realize is, these insurance companies do profit pretty tremendously off of both businesses and individuals by underutilization and just not dishing out the benefits that they are paying for.
Let's say I want to provide dental insurance to my employees. Why should I consider your membership plan, versus a traditional dental insurance plan?
Yeah, great question. Well, in the research that we've done, on average, an employer is going to save about 24% by going directly with someone like me, like a direct relationship with the office. Um, you know, as far as depending on the whole situation, people can have different situations if you need a lot of work done or if you don't. But working with me, you're going to get no hidden fees. It's flat rate. If you need to come in and be seen, it's going to be covered. We're going to give you 15% off of any treatment, whether that's whitening, cosmetic, broke a tooth, you need it fixed, doesn't matter. There's no waiting periods. A lot of times people get, they sign up for their insurance benefits and they got to wait 6 months to a year of paying into it before they get any benefit from it. So it just kind of cuts out the middleman. I can save the business owners some money and they can save me some headache, and we can just have a very relationship driven office.
Yeah, and so it's really not just an employee benefit that you can give to your employees, but it's also a cost saving measure as well.
Yeah, because, like for example, I've talked to business owners and they might have 10 to 15 employees and they're trying to be competitive in the marketplace and they want to offer them good benefits. And so they sign up with an insurance company. And one of them I was talking to, he said, hey, Chaz loved to come see as a dentist. He announced it to his employees that, hey, I've got, this buddy of mine who opened up a really nice office. Does anyone here need a dentist? Of his 15 employees, only about 2 were going to the dentist regularly. So he's paying for all 15 of those employees every month for their benefit. I think it was $37 or $40 a month, and none of them are using it. And he has a good heart. He's trying to give his employees health care, but he is majorly profiting the insurance company. Whereas with my plan, you can offer it, but you only pay for it if they show up. And so you're offering a great care to your employees, but you're not going to get raked over the coals every single month by underutilization.
Gotcha. Wow. Okay. So I totally see why employers love it. Mm-hmm. Obviously, for business owners, it seems to make total sense. Why would the employees prefer something like this?
Let's say you are an employee. What I would encourage you is if you are getting benefits, look, is it coming out of your paycheck, right? Because that can be a hidden cost that you don't realize that you're covering for. So I had a patient the other day who, she had dental benefits through her employer, but she was getting charged about, I think it was $25 or $28 a month out of her paycheck. And, once her funds were exhausted, everything's out of pocket, right? And it's confusing and there's a lot of hidden things. And so every time she comes and sees me for the rest of the year, she's going to have to pay out of pocket, because her insurance company has exhausted all of their benefits. And so I think it's important to realize that dental insurance isn't really insurance. It's a benefit program, right? I use the analogy, with medical insurance, if you have, let's say, a $1,000 deductible, right? And you break your hand, you break every single finger on your hand. Well, you would pay the $1,000 deductible and your whole hand would get fixed, right? Everything else is covered. With dental insurance, let's say you had a $1,000 benefit and it cost $1,000 per finger. Well, then you could say, okay, I'll fix this finger this year, I'll fix this finger the next year. That would be ludicrous, right? So you're going to pay your $1,000 and then you're going to have to pay for the other $4,000, right? So it's confusing. You're in the midst of all of that while you're paying that out of pocket. You're still paying your monthly premium out of your paycheck. And then people get frustrated, right? They're like, what am I paying for? It's confusing. I thought this was covered. Why is this not? Well, I want to do something that's not covered. Like I want to get whitening. So for me, it's just super clear. You pay this per month. We get all your preventative procedures done, your cleanings, your checkups, your emergency visits. Anything you want on top of that, we'll give you some savings on. And you're going to work directly with me. And so it's going to be very relationship driven. And we're not dealing with this third party insurance company who's really dictating your care from afar. They have no interest in you.
And kind of incentivized to charge you, but hope that you don't actually get the care that you might need.
That's how they profit. They profit by you paying every single month, no matter what. And then, sure, they might have to pay out for some things, but most people don't need major procedures every year. So if you're just going in and getting routine care, we're going to catch things early, right? I'm going to have a history with you, and you're going to save a lot of money, especially if you start looking at 5-10 years plus. The savings is pretty tremendous by working directly with someone like me as opposed to, a third-party company that's trying to profit.
For sure. So if somebody's not an employer or an employee that receives this benefit, you're just a person that maybe is retired, or you're in an industry that doesn't have insurance, you work for yourself. What's the system for them? Are they still able to sign up for this?
It's the same. For us, you can pay $32 a month, or if you want to pay for it up front, we can save you a month. So that comes out to either $384 annually or $350 up front. And then it's kind of no frills from there. You had something happen, an emergency visit, come in. We're going to get you your 2 hygiene visits a year. You're going to have a direct relationship with us, get some preferential, treatment, with appointments, things like that. And then, you just work directly with us. So if you want to sign up as an individual, we have a lot of patients who are realtors, or they're self-employed, or maybe they don't receive benefits through their job, but they want to be seen routinely. And we've been really pleased to have them come in and be like, wow, I didn't think I had access to something that I could afford. I thought you were going to charge me for every single x-ray and every single checkup and this and that and nickel and dime me. But it's just very clear, and it's, people love it. So we've had a lot of individuals who have signed up as well.
So as part of the membership plan, just to clarify, $32 a month, what does that get?
So to make it super clear, it gets you all of your exams. I don't care if that's a new patient comprehensive exam or a limited emergency visit. All your exams, all your x-rays are included in that. 2 hygiene visits a year, which is on average what most people need. If we need to get an extra one in there for any reason, we'll talk about that. Fluoride treatments, if you need it, anything preventative is included in that. On top of that, if you need an additional work, it's 15% savings, and that's unending, right? So some of these services that insurance would never cover, whitening, veneers, basically all your preventative care, and anything on top of that, you get 50% off.
I think that simplicity and the direct relationship, along with that transparency, is really what kind of sets you guys apart then from the traditional insurance system.
And one more thing I would say about that is, when if you're going to an office that's very insurance based, then, in order to kind of make that whole system work, it has to be very volume based, right? Mm-hmm. And so it's hard to, again, build that sort of relationship with people where I'm going to consider your mouth, but I'm also going to try to educate you on how your home care, is there anything that we're seeing that maybe we should check out on the systemic end, like your heart, brain, or gut? We're going to be able to spend the time with you, because we're working directly with each other. We don't have this kind of third party that's always gnawing in the background. So again, with my office trying to have a more holistic approach, this membership program allows that.
I think there's going to be more demand for this kind of stuff going into the future. So is that kind of what you see as well? Do you see this direct care or concierge medicine being a bigger thing in the future that more people are aware of?
Yeah, I think, people are realizing more and more, lifestyle and just your life in general is so valuable, and while we need care, we need medicine and all these things, but, having a direct relationship with someone who knows you, who knows your habits, who knows your tendencies, your risk factors, who can offer you a deeper dive into your health. That's why I think concierge medicine is so popular now, because it's getting harder and harder to find a primary care doctor who takes your insurance, and by the time you need to get in, it's a 9-month wait, and you have things you want to talk to them about, but they don't have the time because they have to just to keep demand, they have to see people on such a high level. So, I'm not trying to, I just want to have relationships with people and people that really value their health and just be their advocate. The amount of chronic diseases now is through the roof. I mean, you go out on the street, you're going to meet someone who has celiac or Crohn's or lupus or, at risk for all these things. And we're just missing them left and right because as providers, we're not having that personal relationship with people. And a lot of it is harder and harder because of insurance companies and all sorts of restrictions. So I think with concierge medicine and maybe like my membership plan, people are able to have just more direct care and more access and take the time to actually consider their health and not just seeing them as a set of teeth.
Definitely. And that is a great thing for people and for our community. So I appreciate you taking the time to sit down with me and talk about this today. Dr. Chaz, thank you.
Yeah, thank you, Braden.
For more info on the Local Dentist in-house membership program, visit localdentistbellingham.com.